Sunday was the 2-year anniversary of the start of the pandemic lockdown in Wuhan, central China. Since then, it's been 2 years of living with masks, social distancing, and curbs on things we had always taken for granted. Besides the infection numbers, how are we coping mentally? A research published last year found almost 76 million people worldwide developed anxiety disorders in 2020 because of COVID-19. After physical health, is our mental health at risk now? Is there something we can do to lift ourselves up? Let's hear what our guests suggest. Professor Li Jingzhao of Beijing Foreign Studies University, joining me from Boao in southern China, and joining me from Washington, D.C., Eric Ding, Senior Fellow with the Federation of American Scientists. The warmest welcome to all of you. How are you doing today, both of you?
Thank you.
Give me a smile, please. Okay, a research published in The Lancet last October found that besides the 76 million who developed anxiety disorders in 2020, a 26% increase from the previous year, there were about 53 million new cases of depression disorders. That's a 28% jump, both attributed to the pandemic. So, Professor Li, that's a real upsurge, isn't it?
Right. Yes. Yeah. Thank you for asking me this question. It's a very important question. Sociologists believe that individuals and society can only survive through norms. So the reason for this sudden surge is because all of a sudden our daily norms are being severely threatened and disrupted. For instance, the pandemic has really challenged our normal understanding of virus, disease, and self-protection. The virus is not only, or the disease is not only invisible, but it prolongs and it comes back in waves. And the pandemic has also disrupted our daily routines, our social spaces, and our social relationships. And we feel a sense of loss of control and a sense of loss of predictability. So all of these are building anxiety, not just for particular groups, small groups of social members, but to the mainstream social groups in general.
Eric, what can you pinpoint as the causes that have made us more anxious and even depressive?
Well, thank you for having me. I would like to say that the virus in itself is the determining factor. You know, as long as we don't vaccinate the world, the virus will keep mutating and infecting more people and reinfecting more people and breaking through vaccines until we take it more seriously. And I know it's a very difficult time. And mental health is a serious issue, whether it's adults or children. But I think the neurocognitive damage of long COVID, which many say happens very frequently, anywhere from 15-20% to as high as 50%, the neurocognitive brain damage from long COVID will actually hurt our mental health potentially even more. So it's not a trade-off of simply, it's still getting too difficult with mental health because of the COVID. COVID will actually harm our mental health even more in the near future. And that's why we need to be more aggressive, not less aggressive, and let the virus rip or spread.
Let's talk about, however, let's focus on the mental implications. Professor Li, women are said to be more resilient than men, or we believe so. However, it's found that women were actually found out to be hit harder than men by COVID in a mental way. For instance, according to the same Lancet article, females are more likely affected by the social and economic consequences of the pandemic. Additional carer and household responsibilities due to school closures or family members becoming unwell are more likely to fall on women. They are more likely to be laid off or to be subject even to domestic violence. Has it become just too much for women?
Well, women, although they are resilient, but they have been shouldering most of the burdens for more than 2 years. As you have said, that they are more economically susceptible to this pandemic, because most of them, even if they are working, they are taking up very service-oriented and vulnerable economic positions. So they are the first group to take the first hit or the blow of the pandemic. And also because, as I said earlier, the social relations and social spaces are all heavily compressed within family. And for those moms working at home and those wives working at home, they are totally losing their own private space. So they have to be on constant care of family members 24/7. That has also built a very immense burden psychologically on women.
Young
So,
people, people are also said to have been hit particularly hard, according to the paper. With school closures and wider social restrictions in place, young people have been unable to come together in physical spaces, affecting their ability to learn and for peer interaction. Furthermore, young people are more likely to become unemployed during and following economic crises than older people. Eric, what's your observation there? When young people are affected, are we looking at potentially a COVID generation plus the long COVID you're talking about?
Yeah, I think there will be definitely lasting effects of COVID on the mental health for years to come. But I think the mental health trade-off is not as clear as what you say. In many ways, we know that in the United States, for example, suicides are always higher when schools are in session rather than out of session. And yes, there are many young people suffering, and economic activities, of course, is one of the greatest vulnerabilities of young people. But in terms of the UK, the long COVID in children has tripled in just 6 months. And the percentage of young people with long COVID longer than 1 year has doubled. And that number is only definitely going to rise. It's from pre-Omicron days. And young people actually, according to South Africa, are 49% greater risk of hospitalization than than Delta, and actually higher than elderly. So I think young people, we cannot discount a lot of the long COVID issues. And young people are resilient too. I really want to emphasize that.
Yeah.
And young people can bounce back very quickly. But in terms of long term, we cannot just say, the suffering is too great, because the long COVID suffering will, in the long term, be much more economically and societally damaging.
Professor Lee, what is your understanding of the situation?
Yeah, you have summarized very well all the symptoms of anxiety and depression I have witnessed with my students. I remember that in the spring of 2020, a lot of my students, they had to lock down at home, and they had to do long distance learning, online learning, and I could tell that they were in bad mood every time they came to my class. And even after they come back, the prosperity of possibly losing a lot of job opportunities, because a lot of medium-sized or small businesses are in financial crisis. They are really worried about their future. So to help my students, I remind them that they should try active engagement. For instance, in my class in spring of 2020, I asked them to observe their family members, to keep a family log of everyone's new routine under the new norm, and observe every family interaction, family conversation, and conflict. And very interestingly, because family members are aware that they are being observed, so they are more aware that they should solve their family crisis together, and they also interact more instead of living under the same roof but occupying separate rooms without much conversation.
Yeah. Well, relationships have also come under great strain, supposedly, although there have been different studies showing different results. For instance, overwhelmingly, it's considered a fact that COVID has increased the number of family problems, divorces, and so on and so forth. But there is also a study which shows both marriages and divorce declined across 5 states in the United States. Eric, what is your understanding of the situation? How is your relationship with your wife, by the way?
Well, I think many families I know are going through a lot of difficulties. And I think the pandemic is this great disruption right? Because it's disrupted a lot of people's lives in so many different ways, for better or for worse. And I think that this disruption is not complete yet, because we're still at the forefront of potentially, Omicron not even peaking in many places. I think mental health, the long-term impact will be measured in years to come. And I want to just finally say that I think kids should go back to school, but it's incumbent on adults to make sure that kids are safe, that there are masks, premium masks for kids, N95, KN95 mask, and there should be HEPA filters in schools. The solution is obviously not to keep kids out of school forever, but to keep schools and make them safer. That is the ultimate solution while the adults are trying to deal with Omicron. But keeping kids in a bubble of safety is actually what I care about most.
In terms of dealing with the anxiety, the stress that have, or the depression that have come out, Eric, any idea, any advice? Keep it short, please.
Yeah, well, I think that in terms of depression, I think we need to come together. There's so much, arguing about vaccines in the West and about masks. We need to have is solidarity that says, if you want to be out of this pandemic sooner, we need to come together. If you want your kids to go back to school earlier and go back to school safer, we need to come together. Then, in certain ways, the safety of children is actually what will actually bring adults together more than any other political issue per se. Protecting kids, I think, is a very bipartisan and universal issue, and I hope we will protect kids more in the near future rather than seeing more long COVID.
Professor Lee, already over 2 years we have been suffering this. Any silver lining you see from now on?
Well, I think resilience is really the most important human feature. I think, and also in Chinese context, people are really helpful of each other, really showing a lot of understanding, a lot of support to strangers. So I think the silver lining probably is the pandemic can bring people closer, can bring particularly strangers together and different social groups and different regions helping each other. So the silver lining probably is in the solidarity. And for the youth, I think they are more realized of the importance of peer group support and the importance of not having a lot of stigmatization of those people who have suffered or who have survived the pandemic. I think all of these will be good signs for the future.
Okay, we have to leave it there. Many thanks to my two guests, Eric Ding joining us from the United States and Li Jingzhao joining us from Beijing. And with that, we come to the end of this edition of The Point. Coming to you from Beijing. As always, you can follow me on Facebook and Twitter using the handle Luxin in Beijing. Try to look at the bright side of things. Stay with us.